Hello, everyone. Today I will be discussing autoimmune diseases, in particular lupus. So these are the topics I will be going over. Um, so what is lupus? It is a complex autoimmune disease that affects lots of millions of people worldwide. It's characterized by the immune system mistakenly attacking the own body's tissue, leading to lots of inflammation and damage. So it gets like your immune system gets confused and it starts targeting healthy cells and organs, which then can lead to a various range of symptoms and complications. Um, so autoimmune diseases is a dysfunctional immune system, and then lupus in particular affects different organs and manifests differently amongst every individual, which also makes it pretty difficult to pinpoint that it is lupus and then manage it once it's diagnosed. So, to understand how lupus works, I will be discussing how the immune system normally functions. So, the immune system is designed to detect and eliminate pathogens like bacteria or viruses when we get the flu or a cold. And it is a network of cells and molecules that work together to keep us healthy. But in someone who has lupus, this immune system fails. So instead of fighting off harmful pathogens, it starts attacking the body's own healthy cells and tissues. And so this can cause chronic inflammation, which will then affect different organs and systems throughout the bodies, leading to a range of symptoms that we will dive into later. And so there are 4 different types of lupus. The first one is systematic lupus erythematosus, abbreviated as SLE, and this is the most common associated form of lupus when someone typically thinks of lupus. Because it's the most common and widespread form of lupus. It can impact multiple organs, including the skin, joints, kidney, heart, and lungs. It's known for its broad spectrum of symptoms, and this can make it very challenging to diagnose. And then there is drug-induced lupus, and this type is triggered by certain medications. It mimics the symptoms of the systematic lupus, but resolves once the medication is no longer in use. So this type of lupus can be managed by just not taking those drugs anymore or those medications anymore. The third type is cutaneous lupus. This form particularly affects the skin. The most recognizable symptom is the butterfly-shaped rash across the cheeks and the nose, and discoid type rashes, which are circular and scaly kind of patches that can leave scars. So that's kind of seen in that image there. And then the fourth type is neonatal lupus. And then so this is when newborns of mothers with lupus, so it happens passed down from the mom, and it causes skin rashes, liver problems, and blood disorders within the infant. It's normally temporary and then resolves within the first 6 months. So to the right is the butterfly rash I would just discussed, and then I'll just talk about the symptoms of lupus. So the general autoimmune disease symptoms are fatigue, fever, and weight loss. But lupus specific affects skin, joints, kidney, and the respiratory kind of heart, chest area. For the skin, it makes this butterfly rash in some people. There are different types of rashes, like the discoid ones previously discussed, which are just dry patches of skin. You can also develop mouth ulcers and scalp issues that result in hair loss. A lot of joints will become inflamed and painful. Typically, ankles and arms will become inflamed and really stiff, hands and feet as well. And the kidneys inflame, and this can cause kidney failure or kidney disease, and high blood pressure. And then the heart and lungs causes also inflammation here. So that's a very common thread throughout this disease. It inflames the lining around the lungs, and this can cause chest pain and difficulty breathing as well. So how does lupus get diagnosed? Because it's very, it's not very straightforward. There's multiple steps one has to take unless it's the infant one, which then resolves. So there's blood work that can be done. So they will scan and look for specific autoantibodies, such as anti-Smith antibodies and anti-double-stranded DNA, which is the dsDNA. And these are present in lupus patients, but not exclusive to the disease. So that's just one form of trying to identify what's wrong. Imaging, so this can be screening techniques like ultrasound, MRI, X-rays to help assess the internal damage to the organs. This can be useful for evaluating the joint pain or kidney inflammation. And then the most relevant is the evaluation. So just the documented history of symptoms, a clinical evaluation, and taking physical examinations to identify symptoms like the rashes, joint swelling, and other clinical signs associated with lupus. So how can one manage lupus with treatment? So there are medications that include anti-inflammatory drugs to reduce pain and inflammation. Corticosteroids can control severe symptoms, and immunosuppressants can lower the overall immune system activity. That would obviously in turn make you more susceptible to getting sick by other means. So then each medication has specific benefits and potential side effects. So treatment plans are very tailored to each individual's needs. Lifestyle changes. So adopting a healthy lifestyle can significantly impact the management of lupus, including balancing your diet, regular exercise, and managing stress. These changes can help support overall health and mitigate some of the symptoms that sometimes are often triggered by stress as well, because that can cause inflammation and then cause a flare-up. Specific therapies such as physical therapy can help maintain joint function and alleviate the pain. Psychological counseling can also be beneficial to cope with chronic illness that will sometimes affect mental health and emotional well-being. So those are some of the treatments. And it's also important to note that this specific disease or autoimmune diseases do require ongoing management and regular medical visits. So it's not something that you can just like be like, oh, I diet and I exercise and my stress is good, but it's something that you have to keep checking up on, especially if you're getting more reoccurring flare-ups. So some current research and future directions in this field are some biological therapies. So there are new treatments being developed that target specific pathways in the immune system. These therapies aim to offer more precise and effective management of lupus with fewer side effects compared to traditional treatments. Genetic research. So researchers are exploring genetic factors that may predispose individuals to lupus, and identifying these factors can lead to better risk assessment and more personalized treatment options. And lastly, improved diagnostics. So advances in diagnostic techniques are improving the ability to detect lupus earlier and more accurately. This can lead to earlier intervention and better management of the disease. And these are my two sources for the information in these slides. And thank you for your attention. I hope this presentation has provided you with a comprehensive understanding of lupus, from the symptoms and diagnosis to treatment options and some current research developments. If you'd like to explore any part of this topic further, I would encourage you to seek additional resources like, lupus.org or Medline for autoimmune diseases.